As we move to the next session, so as I shared, we'll be having 2 rooms. So if you are interested in attending the MapUganda presentation by Samson Ngumenawe on how they are responding to COVID-19, kindly remain in this room. But if you're interested in attending the one by Victor Sunday on the work that Unique Mappers Network in Nigeria is doing, kindly click the link on the chat that I'm just going to share right now. Yes, so just maybe a few seconds for people to switch rooms in case you would like to do so. Yeah, so if you're interested in the MapUganda talk, you'll have to remain here, but if you're interested in the one by Victor Sunday, there's a link that I've shared on chat. So yeah, maybe just 30 seconds for if you need to switch rooms before we continue with the introduction for the next speaker. In the meantime, if the tech team can bring up the slides for Samson, then we should be good to go. Okay. Okay, so I think we can go ahead and start. So yeah, the next speaker or the next talk is by Samson Ngumenawe, who's part of the MapUganda team, and he's going to present on their project as well as a rapid response to COVID-19, where they were mapping Uganda border towns, and the project was supported through the HOT rapid response microgrants. So without taking much more time, Samson, you can take it away.
Thank you, Laura. My name is Samson Ngumenawe and I'm a volunteer at MapUganda. And I'm going to use a few minutes to talk about our project that we executed during the pandemic when we were under lockdown. So about this project, it is simple that we got some funding from the humanitarian OpenStreetMap to execute a mapping project where we were responding to COVID-19 because all of the cases were coming from the outside countries, actually the neighboring countries. That's why we decided to map all the border towns to create data and maps that can be used by the responding agencies, that is the Uganda Red Cross and the Ministry of Health, in providing relief services to the COVID-19 pandemic. So this project, we had a number of objectives, and these included mapping all those border towns, but also we wanted to provide training to new people that are joining the OpenStreetMap community, as well as to enhance the skills of the old using QGIS and advanced JOSM, and also the HOT tasking manager for. So we also wanted to create maps that were to be used by these responding agencies. So throughout our project, we had a number of activities, and the first one was to engage the local data user. Actually, we wanted to engage the Uganda Red Cross so that we can collaborate with them as we do open street mapping. because they are using OpenStreet data and all the other spatial data, but we wanted like to strengthen that kind of collaboration between the Uganda Red Cross and MapUganda through this project, and we did that. Then also it's through the same project where MapUganda was onboarded onto the tasking manager to be one of the organizations that can create and run projects on their own through the tasking manager. Then we also had trainings. We conducted a number of trainings on JOSEM, QGIS, the tasking manager, and other data quality tools that included the OSM chart, MapRolate, and other tools. Then with the data that we created on OpenStreetMap, we had a team that was validating all the projects, and then we used that same data to create maps that we are sharing with the Uganda Red Cross and the Ministry of Health. Next slide. Okay, those are some. We achieved almost 99% of our project activities, and those are some of the projects that we created on the tasking manager. They were a total. They were 25 in total, and as you can see, they were all fully mapped and validated. So we are sure that the data that we are using to create maps is really good because the data was validated on OpenStreetMap. Next slide. And that's a screenshot of one of the trainings that we carried out that was about using the new tasking manager. Next. So throughout the project, we also held a mapathon. However much we were under the lockdown, but when it was eased here in Kampala, we had to invite a few of our mappers, and we conducted a mapathon, and that was at the hot birthday. So those pictures that you're seeing, one on the right is the team, actually the coordination team, Stella Maris and Fawaz, when we were doing the map designs, and the one on the left is the one that we took when we had the mapathon. So those are the statistical figures about the achievements. Like we trained about 30 individuals, of which 16 were males and 14 were females. And we created 25 projects on the tasking manager. We mapped them and validated all of them. And throughout the project, we mapped around 25,000 buildings, about 70,000 kilometers of roads, and about 400 kilometers of waterways. Then we had a few challenges, like we were under the lockdown, so some of the people could not have access to the internet because they were locked up, like they had nowhere to go to buy the internet, or some of these facilities like the Hive Collab, which has computers, was locked. So many people couldn't actually access these services. I believe if we were not under the lockdown, we would have had a lot of individuals joining the mapping exercise. So we want to thank the team from Humanitarian OpenStreetMap as the funder, but as well as the team from Humanitarian OpenStreetMap, the Uganda family, because they really supported us in guiding us on how to create these projects on the tasking manager and how to manage them. And also they helped us in designing these maps. Then we also want to encourage other OpenStreetMap communities to participate in hot microgrants so that they can map and make a difference. And then we can have the 1 billion people on the map. Thank you.
Thank you so much, Samson, for sharing with us on your amazing project that you did in Uganda earlier in the year. I'm sure all of us in attendance have been inspired and have learned a thing or two on the work that you did. We're going to